What is up, guys? Welcome to the channel Condition Learning. If you didn't know already, my name is Abdul. I'm a current Oxford medical student and ex-Cambridge Natural Sciences student. And in this installment, guys, we have a really important guest, Professor John Morris, who's going to lay down his words of wisdom. So what am I waiting for? Why am I on the screen? You don't want to be seeing me. You surely want to be seeing him. Hi, John.
Hi there.
How are you doing, John? Good?
Still breathing.
How has your day been today?
Okay, thank you.
Yeah, that's really good to know. So John, I don't want to waste too much of your time. So I guess we'll just get straight into it.
Yep.
So first, John, do you want to just like introduce yourself to those who are going to be watching?
Okay, so I'm John Morris. I've been medical tutor at St Hugh's College, Oxford for a long time. I graduated in medicine in Bristol and have been involved in neuroendocrinology research for all my professional life.
Nice, John, nice. That's a really good introduction. And for you guys at home, John's my tutor at college and also my anatomy supervisor. He's a really excellent anatomy supervisor as well. So John, just starting off with the first question, I just wanted to ask, what would you generally classify as a good candidate? One with knowledge or just one in general that's like easy to talk to, someone you can have a nice conversation with?
Well, quite clearly, people need to have a certain amount of knowledge.
Yeah.
But we're hoping that we can teach them some of that when they come to learn. It's very important that they are reasonably fluent in speaking to other people, because for most medics, that's what they're going to be doing.
Yeah.
So you would also need to be able to really think about what they don't know,
yeah,
as well as just talking about what they do know.
Okay, yeah. So do you think that generally applies in overall, like in terms of the other subjects as well, John? I don't know how much you know about the other subjects. Or do you think this is just more of a medicine thing because you have, you know, the clinical side, you sort of have to have the social skills and stuff like that?
Well, I think it's very important for medicine to have a degree of those social skills.
Yeah, of course.
It's not to say they can't be learned to a certain extent, but they are important when you get into clinical practice.
Yeah, of course. Okay, John. So then, moving on to the next question, John, I just wanted to ask, do you think there's ways in which people can prepare for an interview, perhaps to make them feel more at ease or perhaps increase their performance overall just to, you know, increase their chances of getting in?
Okay, I was expecting a different question at that point.
All right, I sort of rejigged the question. Sorry, John.
Yes.
Yeah.
Oh, right. No. Okay. So, you can prepare, but it's not a question of preparing over a couple of days at the last moment.
Yeah.
You should have been preparing for a long time.
Yeah.
You should have been reading widely in things that interest you, even developing your own particular bit of expertise, even before you start thinking of university.
Yeah.
So, yes, it is important to prepare. You want to think about questions that you want to ask. You want to think about questions that you think you might be asked and how you might answer them, and perhaps try those out with somebody. Okay,
so you suggest essentially building up those skills really early on, like sort of knowing your subject, not probably at the standard you should know it at the end of the course, but sort of touching the surface a bit more. And then, sort of as you get closer to the interview, then, you know, formulating some questions and then asking someone else to sort of ask it and then trying those out. That's what you suggest, John?
Doing a bit of practice.
Yeah.
Quite literally.
Yeah. All right, cool. Excellent, John. So next question, John, I had a couple of people just, well, these are students I had in the past, and they were just feeding back onto me what happened at their interview. And some of these students, John, asked, why are some interviews like particularly tough? So as in like, they can sort of make the interviewee feel like they're in a sort of uncomfortable position, if that makes sense.
Okay, well, I think some interviewers do a sort of tough guy approach. with interviewing, I wouldn't take much notice of that. In relationship to one of your other questions I thought you might ask,
Yeah.
I remember phoning, when we were allowed to phone candidates to done well, I remember phoning one candidate who said, "Oh, I think you must have got the wrong number and the wrong name. I did a terrible interview with you."
Oh, right. Yeah.
So you can't really,
Yeah.
I think, judge how an interview has gone.
Yeah.
Some people will push very hard to see what the limit of the knowledge is.
Yeah.
And others may do it slightly differently. There's going to be a variety of ways. I think just answer the questions as far as you can.
Yeah.
Perhaps if you're not quite certain of the question, certainly,
Yeah.
ask for a bit of clarification of the question.
Yeah.
Don't be scared to do that.
And also, John, what about those situations, for example, where I think some interviewers sort of test, like, is the student sort of confident with their answer? So what do you think they should do in those situations? Is it like they should try to defend their answers at all costs, or sort of when is like the borderline, when is like the fence in which case sort of they'll sort of give in, sort of thing, if that makes sense?
Okay. So the sort of question, are you certain about that?
Yeah. Also, yeah, exactly that. I remember you asking me, actually, John, quite a few of those questions at my interview.
Did I? Oh, right. Well, I think there,
yeah,
the thing to do is take a moment to think and to pause.
Yeah.
Did I get that said right? But if you're fairly certain, say, yeah, I think that's right. Yeah. And I think it's right perhaps because.
Oh, okay, yeah.
Now, try and give a reason why you think that's right. And may trigger another slightly different question and so on.
So I think that's why, John, isn't it, that a lot of the people suggest you sort of think out loud, because rather than, just saying your answer straight away with giving no like underlying reasoning, that's obviously not going to look good, is it? It's not something you're looking for.
Yes, yeah, certainly that's the case.
Yeah. So
you might want to say, well, in relationship to this question, if we look at this point, so you're just thinking your way through the problem.
Yeah.
Don't just think that there's an automatic answer that somebody's expecting.
Yeah. So go from underlying principles of what you do know and sort of build your argument from that and sort of generate a hypothesis.
Absolutely.
Yeah.
Yeah.
That's the advice I've been giving students over the years. Yeah. Perfect, John. Okay, John, skipping to the next question, probably not in the order you expected, but would you say the first impressions at the door do count? Or do you think that doesn't really affect anything?
No, I really don't think that they count. In fact, one technique that one would often use is a relatively sort of straightforward question about their previous life, school experience or something like that, to put them at their ease.
Yeah.
We know that all candidates are likely to be pretty nervous come in.
Exactly, yeah.
So
yeah.
I would always recommend a candidate not to have their hands on the table.
Oh, right.
And start.
I might have actually been doing it in my interview. Oh, dear.
Just to tuck their hands down in their lap and really look at the person who's talking to them and think.
Yes, I think I also agree.
There's not necessarily
because
an easy answer.
Yeah, the nerves are always obviously going to be there, but doing this and showing them is not obviously going to look as good as just putting them underneath the table. All right, cool, excellent, John. The next one's actually quite a big question. So generally, they actually ask a lot of my students told me, like, why do you want to study the subject? What do you think is the best way of doing this? So firstly, like in general, like just in terms of any subject, and then maybe in terms of medicine, how you would go about answering that question.
To be honest, I don't usually ask why they want to go into medicine.
Yeah.
I don't find it a useful question.
Mm.
I will certainly ask, tell me one interesting experience that you've had
Yeah.
that has led you to think that might be the course for you.
Yeah.
And then, or describe one person that you've met, you know,
Yes.
some particular circumstance. I don't think I've ever asked what to do medicine.
Yeah, but just in general, so generally what I told the students to do is when, for example, if they ask why medicine, I sort of told them to formulate an answer such that if someone was to look at that answer, the only conclusion they'll come to is medicine. Do you think that's the right approach to these questions? Or so, because generally, like a general reason someone would say, for example, is I just want to help people, right? But then you can equally say you can become a nurse or you can become a
absolutely. Oh, I remember one person very early on asking that question, and I can't remember quite what the context, but I gave it almost exactly that. You know, oh well, why don't you do X?
Yeah, exactly. Yeah. So
lots of ways to help people. Huge number of different ways in which to practice medicine. I'm saying if you compare the life of a child psychiatrist with a post-mortem pathologist.
Yeah, exactly. Yeah,
they're both doctors.
Exactly. Yeah. So even within the field of medicine, there's stuff you can do which is not really, you're not really a doctor, but it's sort of related. You know, like working in a genomics lab or something like along those lines.
Yeah.
So, yeah, I sort of think of these problems as like a flowchart, John. So like saying, if you say I want to help people, you have so many things, and you have to narrow that down until you get like to the final like path, which should be like medicine, the right option. All right.
That's right. Any medical course that's worth its salt should have you wanting to be a preclinical scientist, and then this, and then that as you go through your clinical course.
Exactly, John. Exactly. Yeah, totally agree with that. Next one, John. So generally in the Oxbridge interviews, they normally give you like a picture or like a graph, like, you know, to sort of describe. Would you say like, so you see the picture, would you say just sort of touch the surface of what you can see, or get straight into the details? Like, I think this is that, I think this is that, or do you think it's best to wait for the interviewer to slowly introduce like the next steps?
Oh, I think I would certainly wait to a certain extent.
Yeah.
The interview shouldn't be just sort of putting something down and saying, what do you think about it? But you need to know what the question is going to be.
Yeah.
So, but don't to some immediate conclusion. Make sure you're just answering what questions are being asked about the problem.
Yeah.
Don't just jump to a conclusion, because the chances are the whole thing has been put together in the sort of way that it's not that easy to jump to a conclusion.
Yeah. Because I think it's just like underneath the stress of the environment, it's like, you know, you think you know something, so you just sort of just waffle stuff all over the place and sort of formulate stuff. So I think that's the problem there. And in general, John, so just say like, yes, go ahead.
I think you're absolutely right about that.
Yeah.
Don't just carry on talking.
Yeah.
Answer what the immediate question that's been answered, but don't just go on and on talking.
Yeah, exactly. Yeah. So I think even I'm probably a victim of that. I've probably done that in my time, but I think in retrospect, it's something definitely I would tell other people to do. And just on follow up to that, John, if like, for example, you really think you know what you're talking about, do you think you should sort of, I don't know how to put this, like juice out the question? So for example, so start to simulate a conversation from that, and so that leads on to another tangent? Or do you think you should just strictly go, like, maybe like, for example, you asked me something about, let's just say like a lung pathology, and I've done quite a lot of research on that. Do you think I should sort of involve that in the conversation?
I think you could just follow it up by saying, I remember looking at a paper on this, or something like that. Yeah.
Would you say that gives you bonus points then, John, or not so much?
Yes, because if it tells you something that the interviewer doesn't already know,
Yeah.
that I mean, say, for example, if it was something you found in your application,
Yeah.
then you might like to say, well, as I mentioned in the application, I've actually looked at,
Yeah.
lots of lung x-rays with a doctor friend of the family or something like that.
Yeah.
It just
Also,
tells you something.
fill in the gaps, essentially. Yeah.
Yeah.
And just a last
But
follow-up.
don't witter on.
Yeah, exactly. Yeah. Just a last follow-up to that, John. Do you think it's a good idea to sort of research about who's going to interview you? Would that potentially give you clues on what might come up? So, for example, just say I see in my interview, I have Professor John Morris for this interview. Do you think it's a good idea just to research what you do generally? Would that give me a sort of idea what's going to come up?
I think knowing just a little bit, I don't think it will necessarily tell you what's likely to come up, though at an extent it might be, because any interview will want to pose a question that they're very familiar with the area. So yes, just a little bit of, well, it's quite literally thinking about the sort of questions that might be asked.
Yeah, exactly. Yeah. All right, excellent, John. So just skip to the next question. So quite often, actually, I mean, I'd say it's probably impossible for you to have an Oxbridge interview where you just know all the questions. So what would you do, John, if you got asked a question and you literally have no idea, like, whatsoever? So what else your take on that, John?
Okay, so a difficult question comes up.
Yeah.
You might say something like, immediately think of the answer, but we go back to first principles, depending on what sort of a question it is, or it would depend on the sort of question. Are you talking about the question where you're presented with a particular problem, or just a straightforward question?
So generally, from what I have, from my experiences of Oxbridge interviews, John, it's like they normally start off really easy, like something you would know, and then they'll just throw out like a diagram which you've never seen before, and then you just literally don't know what to say.
Oh
yeah. So in that situation, John, what would you do?
In that situation, you might say something like, well, I've never seen anything like this before, but what I can see on this piece of paper is the relationship between, I don't know, plasma oxygen content and something else. So
sort of just say what you can see, and then I guess the interviewers can chip in and sort of give you ideas and sort of put you in the right direction. Okay. Yeah, excellent, John.
But don't, once again, just don't carry on talking. Just give them something.
Yeah.
This is roughly what I can see on this graph.
Yeah. Yeah, exactly.
And then pause and wait for them to ask you a question.
Yeah, that makes a lot of sense, John. The next question, John, was, I think we kind of touched upon it before, but it's so I presume that the interviewers already have a sort of approximate line of questions that they're going to ask. Is it possible, like something, the student mentions something really controversial and then the whole interview is taken up by that rather than asking the normal line of questions?
No, I wouldn't let it take up the whole interview.
Yeah.
But if a student raises a really interesting point, I might very well want to follow that up for a few moments.
Yeah.
Just to see whether or not they've raised it because they think it would be something a bit fancy to say.
Yeah.
Or whether they really know a little bit of something about it.
Oh, okay. Yeah. But I guess that would only come up if it's like super controversial or something, you know, you might want to touch up a bit on, I guess.
Oh, well, not necessarily. Sometimes people get asked what sort of books they might have read recently to see, you know, what they're interested in. And I've come across various people who have mentioned a particular book, which I know something about. And I say, oh, you know, tell me something about that. Oh, can't really remember. It was a long time ago since I read it. And
right. Yeah.
that's what you don't want to do. You don't want to set yourself up
Mhm.
not to be able to answer the follow-up question.
Yeah. So again, I think that brings us on then, John, to like stuff you said in the personal statement. So then I guess before your interview, you should like look at your personal statement, look at any books you read. I'm presuming you shouldn't know it in like super detail, but just like a superficial touch on those books, sort of like a blurb, reading the blurb, something like that.
Yeah, so I'm saying you might be asked, oh, what did you find interesting in that book? Or I see you went into a GP's surgery in your hometown.
Yeah.
Tell me about one patient you saw there that was interesting.
Yeah.
Something like that.
So I think for medicine, I think there's more to ask, right? Isn't it? Because you have a load of experiences and stuff, more things to see. But in general, yeah, for other subjects, definitely, I do see people talking about books, and I guess that's something they definitely should take into account. What about anything else, Sean, in your personal statement? Do you ask about anything else in the personal statement? That's do you ever even go into?
I always look very carefully at the statement.
Yeah.
I'm always interested to know what students might be interested in doing in their non-academic work time.
Yes, yeah. I think that's really important.
In other words, what's the rare aspects of their personality?
Yeah.
Because hopefully they're going to contribute something more than just learning the work.
Yeah, exactly. And I think that falls back on, John, when we were saying about in the interview, do you look for people who are like essentially have good personality or are knowledgeable? I think the personal statement, I guess, then covers the grounds of sort of judging personality, like from the extracurricular stuff. Yeah. Yeah. I think that's a good way to put it.
Absolutely.
Yeah. And actually, just one last follow-up to that, John. What do you think is more important, the reference that someone writes about you or your personal statement in itself? Would you say one's more important than the other, or would you say they're like equally weighted?
I think that's a very difficult question to answer because actually references vary quite a bit in their usefulness.
Yeah.
So I think what we do is we read all of it carefully. We make notes on particular points that might want to come up in the interview.
Yeah.
That you might want to ask a question about. But I wouldn't say, I'm saying we obviously take notice of what referees say.
Yeah, because there's a second person talking about oneself. Yeah.
That's right, yeah.
Yeah. Okay, John, just the last question. So this is like at the end of the interview. So like, is there like any way a student can tell if they've done good or bad or not really?
Well, like I said, when we were allowed to ring up students, I've had students saying, oh, can't be me. I did a terrible interview with you.
Like they want the lottery,
so
yeah.
I think the thing to do is to think, if you interview coming up, think, well, what might I have done differently? But just put that interview behind you, learn, and just go ahead, and don't try and predict too much.
Yeah.
I'm saying hopefully you'll the interviewers job properly. You will at least feel that there have been a number of questions that you've been able to answer and show off your knowledge in.
Yeah. And I think,
and
John,
even if
go ahead, John.
What I was going to say is, even if a student is really floundering, what I will always try and do is to have a really easy question that they can answer, so that they're not just panicking. Because what I want to find out is what they know and understand and think, rather than what they don't know and understand.
Yeah, totally.
You see what I mean?
Yeah, exactly. I actually understand
I want to find where they are.
And
what we're trying to judge is what might they do come to the university and the course they've applied for.
Yeah, that's essentially what I've gathered, John, from a lot of the different tutors I've had before here and in Cambridge as well. And I was just going to ask John. It's actually skipped my mind. What was it? Yeah, I was just going to say, John. Yeah, like even if you don't get in, it's like a really good experience, to talk to someone of that academic caliber. So it's just a good experience that you can, I guess, it's like transferable skills, if you understand. Like, as in, even though you might not be successful here, you can use it for another interview. Yeah.
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 And in fact, as far as Oxford interviews are concerned, many of the people who we can't take will go on and be very successful in other places. So
exactly. So it's not the only port you can enter. Yeah. So John, any other final words of wisdom you can give to the students who are watching this?
Good Lord, words of wisdom. I think be yourself. Don't try and be something that you're not. Don't try and pretend things. Just go ahead. Yeah,
definitely, John. I definitely agree with that. I guess forcing a character that you're not is not going to win in under any circumstance. Definitely agree with that. Yes, John. So I guess that's the end of it. And yeah, it was really nice talking to you, John. Thanks for giving up your time, and I'm pretty sure it will be really, really helpful for the students who are watching this. And yes, John. And I think I'm going to see you in the next anatomy tutorial sometime soon.
I think you are. Yes.
Yeah. Hopefully, I'm
Make sure you know your stuff.
Definitely, John. Definitely. So, John, I'll leave you there, and then I hope you have a good rest of the day and a good weekend, John. Thanks for your time, John.
I'm really sorry I can't be coming into the dissecting room at the moment, but I'm supposed to be too old for that.
Hopefully, post-COVID, you can show us a trick or two.
Hopefully, post-successful vaccine, I shall be in there like a shot.
Yes, exactly, John, exactly. Great, John. So thank you very much. Thank you very much. See you soon, John. See you.
Yeah. You're welcome. Bye-bye.
Bye, John. Okay, guys. Now, that's the end of that video. Hopefully, you found it insightful. And if you want to see more content like this, like, comment, subscribe. Now, see you in the next one. Peace.